There are groups that are at greater risk of completed suicide. So the young and the old, men more than women, people who are abusing substances would put you at higher risk. And then people who have past suicide attempts are at greater risk of serious suicide attempts in the future. Those are some of the demographics.
So it's interesting that men are more likely to complete a suicide, but women are more likely to try and fail or to try and not do it as lethally, or do we know why?
There are people that we see on crisis. In fact, this is a kind of a large part of what we do, who are chronically struggling with these thoughts and may act on them. But for instance, people who cut. People who cut, to be graphic, you know, it'll really run the gamut. So there are people who basically are scratching themselves and may draw blood, but it doesn't really require any medical service and then medical attention. Then I've worked with some people who make very serious cutting.
But they still live often.
Yes, but there are people who cut and might not have lived. There are people who cut and it would be very hard to die from the nature of the cut.
But there are also people who cut and someone hadn't found them.
Yeah, and then there are people I've known who cut pretty deeply and seriously and yet bring themselves quickly to medical attention. And so, you know, certainly people can miscalculate, but you know, if you cut and walk out into the street and people see you, you're going to get to medical attention. Or if you pick up the phone and call someone right away, you'll get to medical attention. So it's a, you know, it's a tricky business, and everybody's different, and you need to sort of talk to that person and evaluate what the behavior was in the context. It's all serious, but there are some attempts that seem to be more lethal. You know, who was around? Who would have known that you were doing this? You know, did you call for help, or were you found by accident? These are all the kinds of things that we ask when we're evaluating someone.
Is there anything you can see? We seem to have a somewhat higher rate of suicide than our neighboring states and than most other states. What is there, if anything, that you can see about Vermont that might help explain that?
Well, I'm not sure, but one thing that would concern me is the pretty ready access to guns in Vermont. I once, in the public health realm, there was a professor who came and gave a talk at University of Vermont a few years ago about suicide prevention from a public health perspective that left a big impact on me. And what he said was, when you look at this, they looked at people who had made very serious suicide attempts but hadn't completed it, but close. So people who jumped off the Golden Gate Bridge or something, that's a pretty serious attempt. And you're basically just lucky if you survive that. And they found a few things. First of all, 3 months after, these people hadn't made repeated attempts. And so it seemed like if you were able to intervene in the moment to prevent it, that you could probably have a big impact. It wasn't like the person just kept going out and trying again and again and again. But access to means was a big impact. And the argument that he was making was putting up those big barriers by bridges could have a much greater impact on reducing suicide than getting people treatment for depression. That there were people who completed suicide that would get into a momentary state of feeling that their life wasn't worth living. And if you can get them over that state, keep them safe, and not have easy access, that they would survive. So putting barriers on bridges, but not having access to guns. You know, a gun is so dangerous and so lethal, it's pretty hard to survive that. And so if you can keep someone from having access to it, then, you know, you may help that person to live another day and maybe see some other options on that other day.